Hello, and welcome. Today, we're diving into the world of cardiology to understand a fascinating, and sometimes critical, heart rhythm called the ventricular escape rhythm. This rhythm is a lifeline, a backup system that kicks in when the heart's normal pacemakers fail. Join us as we explore its causes, symptoms, diagnosis, and what can be done to manage it. So, what causes a ventricular escape rhythm? Simply put, it's the heart's last-ditch effort to keep pumping. The primary culprit is failure of the heart's natural pacemakers. This includes the sinoatrial node, or SAE node, which usually initiates each heartbeat, and the atrioventricular node, or AV node, which relays the signal. Conditions like sick sinus syndrome, complete heart block, or damage to the AV node due to heart attacks or certain medications can prevent these pacemakers from functioning properly, forcing the ventricles to take over. Let's talk pathophysiology. Normally, the SAE node fires, sending an electrical signal that travels through the atria to the AV node and then down to the ventricles. This coordinated sequence ensures efficient heart contractions. However, when the SAE or AV node fails, the ventricles, which have their own inherent ability to generate electrical impulses, step in. The ventricular cells fire at a slower rate, typically between 20 and 40 beats per minute. This slower rate can be insufficient to meet the body's demands, leading to various symptoms. The exact epidemiology of ventricular escape rhythm is difficult to pinpoint, as it's often a secondary phenomenon resulting from underlying heart conditions. Its prevalence increases with age and the presence of pre-existing cardiac diseases like coronary artery disease, heart failure, and conduction system abnormalities. People taking medications that slow heart rate or those with electrolyte imbalances are also at a higher risk. What are the signs and symptoms? The most common symptom is dizziness or lightheadedness due to the reduced cardiac output. Patients may also experience fatigue, shortness of breath, chest pain, or even fainting spells known as syncope. In some cases, a ventricular escape rhythm may be asymptomatic, especially if the rate is relatively fast and the body can compensate. However, in most instances, the low heart rate is noticeable and concerning. Diagnosing a ventricular escape rhythm relies primarily on an electrocardiogram, or ECG. The ECG will show a slow heart rate, usually between 20 and 40 beats per minute. The QRS complexes, which represent ventricular depolarization, will be wide and bizarre-looking, indicating that the electrical impulse is originating from the ventricles rather than following the normal conduction pathway. Sometimes a Holter monitor, which records the heart's electrical activity over 24 to 48 hours, may be used to capture intermittent episodes of the rhythm. While not strictly types, ventricular escape rhythms can vary in regularity and the specific ventricular focus initiating the rhythm. A regular ventricular escape rhythm suggests a stable though slow ventricular pacemaker. An irregular rhythm may indicate multiple ventricular foci firing sporadically, which is generally more unstable and concerning. Treatment for ventricular escape rhythm depends on the underlying cause and the severity of symptoms. If the rhythm is caused by a reversible factor, such as medication or electrolyte imbalance, correcting that factor is the first step. However, in many cases, a permanent pacemaker is required. A pacemaker is a small device implanted under the skin that monitors the heart's rhythm and delivers electrical impulses to stimulate the heart when its natural pacemakers fail. This ensures a consistent and adequate heart rate. Preventing ventricular escape rhythm focuses on managing underlying heart conditions. This includes controlling blood pressure and cholesterol, maintaining a healthy lifestyle with regular exercise and a balanced diet, and avoiding smoking. Regular check-ups with a cardiologist can help detect and manage potential problems before they lead to more serious arrhythmias. The prognosis for patients with ventricular escape rhythm varies widely depending on the underlying cause and the presence of other health problems. With pacemaker implantation, many patients can live normal, active lives. Research continues to improve pacemaker technology and identify new ways to prevent and manage heart rhythm disorders. Newer pacemakers are smaller, more energy efficient, and can even adapt to the patient's activity level. Ongoing research is also exploring gene therapy and other innovative approaches to restore normal heart rhythm in patients with conduction system disease. Thank you for joining us on this exploration of ventricular escape rhythm. We hope you found it informative and insightful.